Hey guys, today I'm going to attempt to explain something that's a little bit more complicated. Whenever we talk about the oxygenation or stopping breathing at night, we're really always focusing on the fact that we are getting deoxygenated, and that it is very harmful and it's not good. However, there is actually a much worse event that happens, and that's increased negative pressure inside our thoracic cavity. What does that mean? Is that during our normal breathing, we do create negative pressure inside our chest. That's how we can get the air into our lungs, and lungs can't expand. And during a normal breathing, it can be anywhere from, for average person, from -5 to -8 centimeter of water. That's how we measure this pressure. What they have done during episodes of people that have apnea, they have seen that the negative pressure in these chest cavities can go as high as -60 to -80 centimeter of water. What does that mean? That's equivalent to 0.8 pounds all the way to maybe 1.5 pounds of pressure. Now, I want you to imagine this. This is a heart. As you know that your heart is encapsulated in a fluid-filled sac called pericardium. And that negative pressure is going to put pressure on that heart. At the same time, this heart is trying to fill in with blood and expand to push it to your system. And it cannot do that. Now, the average person with mild to moderate apnea has 13 to 15 episodes per hour of this pound of pressure on that heart. In medicine, they call it cardiac tamponade. It usually happens in severe trauma, when somebody falls under a big brick of wall, or in a car accident when something gets pushed onto the chest and they cannot expand. Imagine going through that 13 to 15 times per hour for night after night. That's why hearts stop working, or cardiac arrest happens.